horse and for a horse owner. And the reason is that colic seems to strike indiscriminately, and unfortunately it is the biggest killer of adult horses. The good thing is that most cases of colic are fairly mild and will respond to simple medical treatment, but those that don't may require intensive hospital treatment and surgery, and that's what I want to discuss in detail today. Firstly, what is colic? Colic is simply a horse with a tummy ache, with some kind of pain in its belly. This can be similar, anthropomorphized and similar to humans. It can be as simple as indigestion, or if you have some inflamed intestines and diarrhea, that can be painful. You can have tummy cramps. So it can be as simple as that. But also it can be more complicated, like a twisted gut, and a similar condition in humans would be an appendicitis, where your appendix is expanding and will burst if it's allowed to, and the treatment required is going to be surgery. So there are hundreds of different types of colic, and I'm not going to go into each of those individual types, that would take too long. But what I want to give you a picture of is how colic is treated and when horses need more in-depth, detailed investigations and treatments in a horse hospital. So what are the signs of colic? Horses with colic typically paw the ground, and they become distracted, they sort of flank watch, they can roll on the ground, and they can show a whole lot of signs of abdominal pain. So this horse here in the picture is having a look around at his flank, and he's trying to tell the owner that he's got a painful abdomen. Horses with more severe types of colic may be rolling on the ground, and you may not even be able to stop them. This is another young horse showing signs of colic, and he's in the hospital with a drip tube attached, but he's pawing the ground continuously and is in a considerable degree of pain. And this is another horse in the hospital who's actually trying to roll on the ground, and this is despite administration of painkillers. This horse is quite painful and is trying to get down and roll, but we're not letting him do that because we're going to take him into surgery to try and help him out. The main thing an owner needs to understand with colic is when is it serious, and when do you need to bring your horse to a hospital for more detailed treatment and investigation. This can be simplified. If a horse responds to a simple painkiller within 10, 15, 20 minutes of administration of the painkiller, then it is likely that it is a relatively simple colic, such as a bit of a spasm of the intestine or a bit of indigestion, and that horse will most likely need no further treatment whatsoever. But my simple rule is, if a horse is given a painkiller and he's still showing signs of colic, then that is an indication that this is a bit more serious. I'll go back to the appendicitis comparison in humans. If you've got an appendicitis and it's about to burst, you don't just want more and more painkillers. What you need to do is go into a hospital where surgical treatment may be considered appropriate. So if your horse is colicking and it's been giving some painkillers and it is still colicking, then that is a sign that further treatment and further investigation should be undertaken. And you need to call your own vet back, or you need to think about bringing the horse to a horse hospital, an equine hospital. Like I said, there are 100 different types of colic, and all of the different types of colic are going to be very hard to differentiate by yourself, the owner, and the only way we're going to be able to differentiate them is by doing scans in the hospital, passing stomach tubes, and doing rectal examinations. Those might give us a clue as to what is the cause of the colic. But even so, many times we're still actually guessing about what may be the cause of the problem. And we may not know the full details of exactly what's causing the colic unless we do surgery. But what I want to reiterate is that if a horse is colicky and it's given a painkiller and it doesn't respond to the painkiller, then you know you're in trouble basically, and that horse needs to have more intensive investigation and care and possibly surgery. Fortunately, only maybe about 1 in 20 horses with colic will actually require surgery. So the vast majority of horses actually don't need to come into a hospital when they have colic. But if the signs come back after the painkiller has been administered, or if the colic signs don't go away after the painkiller has been administered, then that's a warning sign that further investigation and treatment is needed. So this is a horse entering the theatre at Troytown Equine Hospital. This horse has had a colic which has not responded to painkillers. You can see there is a tube into his mouth, that's the endotracheal tube, and also there's a tube into his nose. That tube has been passed into the stomach to allow decompression of the stomach. And the nurses and the vets are working fairly quickly to get the horse onto the anaesthetic machine and get the horse prepared for surgical treatment and investigation. Some pads are being used to make the horse as comfortable as possible in the upright position and get him in the best possible position for the surgical team who will be preparing themselves full flow now. The surgical team in blue, and the horse is covered with the surgical drapes, and the anaesthetists working away to monitor the horse extremely closely. He's on his back and monitoring his vital parameters and keeping a very close eye on him under the anaesthetic. This horse has unfortunately got a bit of bruising around his eye, which we'll show you as a result of the colic and banging his head in the stable. So you can see the bruising and swelling and grazes around his eyes as a result of the fairly severe colic that he's experienced. And this is the surgical team and myself on the right, working away to decompress the intestines and explore the abdomen thoroughly to find out exactly what's wrong. And this is a close-up of the intestines. I hope you're not going to find this too gory. What the surgeon here is doing is pulling the intestines from the abdomen little by little to explore it. Fortunately, these intestines look nice and pink and healthy looking. They are a little bit distended. This is small intestine that the surgeon is pulling out, so there is some kind of a blockage going on in this horse, but at this stage it looks as though it'll be able to be resolved, although the surgeons are still working out exactly what is going on. So when we do colic surgery, what we do is we pull out all of the intestine that we can possibly pull out of the abdomen and explore it thoroughly and try and find out exactly what is wrong. Unfortunately, in this scenario, you can see the intestine is purple and blackened in areas, and there is a hemorrhage in the tissue that suspends the intestine in the abdomen, in what we call the mesentery, and all of that intestine is unfortunately dying as a result of a twist. And this horse I'm going to show you now has got some adhesions of the intestine to each other, and the intestines have unfortunately, these adhesions have acted as a focus of a twist. So this horse has undergone quite a severe twist of its small intestine, and unfortunately this is not going to be recoverable for the horse. This intestine would have to be amputated. This is much more normal intestine than I'm just showing you now, but even so you can still see the discoloration and the inflammation and the hemorrhage within the mesentery of the intestine. And each colic is different. We sometimes find things we don't expect to find despite our exhaustive tests before a horse goes into surgery. This is the first horse again being transported back from the surgery suite into the recovery room, and he's being moved on the hoist, and he's going to be positioned close to the wall in a certain position which will be the best for him to recover. This is a slightly risky period because the horse has got to recover from a sleeping position to the fully standing position, and unfortunately there is a risk of a horse injuring himself during the recovery phase. What we do at Troytown is put some ropes on the horse's tail and on the horse's head, which can steady the horse as he is recovering and try and minimize a horse injuring itself in the recovery room. So unfortunately there are lots of myths about colic, and one of the myths is that it's important to stop a colicky horse from rolling. I think this has its origins in the fact that horses with a severe colic, what we refer to sometimes loosely as a twisted gut, will have very severe signs, and these signs of colic will involve the horse rolling. And people have sort of like linked the two and said that a horse rolling will cause it to have a twisted gut, whereas really I think in the majority, or maybe even all cases, the actual twist comes before the horse is rolling. So therefore it's not absolutely important to stop a colicky horse from rolling, because usually the problem has been inside the abdomen has been done, and stopping the horse from showing the signs of the pain and rolling around is not going to make much difference. The most important thing is to get a painkiller and sedative into the horse if necessary, to try and calm it down and allow your vet to investigate and examine your horse more closely. Another myth is that all horse colics can be prevented. As I've said, there are hundreds of different types of colic, and not all of these colics can be prevented. The way the horse's intestines are laid out inside its abdomen make it prone to having sometimes twists and displacements, particularly in brood mares. But there are little holes in the horse's abdomen where internal herniation and entrapment of bowel can occur, and those pieces of bowel that become herniated can die and require surgical treatment. But those types of colic, it is almost impossible to prevent. So please don't get me wrong. I'm not saying that we shouldn't, pay really good attention to our horses' diets and make sure our horses go on good worming programs, and back those worming programs up by taking dropping samples and doing worm egg counts to see if our horses have got parasites, and doing all of those things we can possibly do to try and prevent a horse from colicking. But unfortunately, some colics are absolutely unpreventable, and therefore the main thing is to be able to identify those colics that actually require more intensive investigation and treatment, maybe in a horse hospital. And can a horse be the same after colic surgery? Yes, they can. Many horses recover fully after colic surgery and go back to their previous function. And in surveys we've done at Troytown Hospital, approximately 3 in 4 horses that undergoes colic surgery will recover and go back to full function, whether that's racing, show jumping, eventing, or being a broodmare or a stallion. So horses can recover fully from colic surgery. And the most important thing is that the colic is identified quickly and that the horses are sent to the hospital as quick as possible if the colic is anything other than just a simple colic that responds to one shot of painkillers. What I'd like to conclude with is that the most important thing I want you to take out of this seminar, and that is that if your horse has colic and he has a painkilling injection, and that painkilling injection doesn't resolve the signs of colic, then you ought to consider getting your horse investigated more thoroughly in a horse hospital and possibly considering colic surgery. Like I said, the vast majority of horses will not require colic surgery, but if a horse does require colic surgery, it wants to be as quick as possible after the onset of the colic. And I go back to my comparison with human appendicitis. If you've got an appendix and it's about to burst, you don't want just more morphine. You don't want more painkillers. You want a surgeon to be able to resolve the problem. Thank you for listening, and I hope you found it interesting. And if you have any questions about colic and surgery in particular, then please feel free to contact us at the details on the screen.